Welcome back to the Stigma podcast. I'm your host, Stephen Hayes, and today's guest, Dr. Nick Allen, is the co-founder of Ksana Health, which he launched in 2019 to really take the tools and the technologies that he had developed as the director of the University of Oregon's Center for Digital Mental Health into mental health care products and tools and services. He's a clinical psychologist. He's a social neuroscientist, and his focus throughout his career has been on the interaction between biological and psychological and environmental risk factors, most specifically around adolescence, and measuring these things to fully understand how to prevent mental health problems and encourage healthy development during such a critical stage of life. So I'm excited to have Nick here to talk to us about what he's done, what he's building at Ksana. And so without further ado, Nick, thank you so much for coming on the show.
It's great to be with you, Stephen. And I've got to say, I'm a big fan of the podcast, a regular listener. So it's a real pleasure to be joining you.
Well, that's awesome. I would love to start with having you share a little bit about your story with our audience, if that's okay with you.
Absolutely. Yeah. So I'm, I guess, part of the story that's important to get out there. If people are, maybe some people can tell this right now, but I'm originally from Australia. Grew up in Melbourne, Australia, and I'm trained as a clinical psychologist. So, started my career there, did a lot of clinical work before I went back into research, and then started to really dig into research as a way of moving things forward, and got into being a professor of psychology at the University of Melbourne for many years. Really was interested in training and teaching and generating new approaches to mental health. And my focus throughout my whole career has been on young people. And by young people, I mean people aged sort of between 13 to 24, that period of life, because that's such a critical period of life for mental health. And particularly for people who are going to have mental health challenges throughout their life, often this is the period of life when they first really present themselves. So I've been really interested in what are some of the causes of mental health problems, particularly depression, anxiety, substance use, as well as preventative interventions and treatments, and been developing those over the years in my research and my training and my own clinical practice. So that's kind of the broad background to my career. But around about 8 years ago, I guess, not long after I moved to this new job at the University of Oregon, where I'm professor there now, I really got fascinated by the idea of digital technology and whether digital technology could offer us some opportunities to really solve some of the long-standing problems we've had in mental health services and how we support people experiencing mental health challenges. So we started doing research with digital tools, particularly with mobile and wearable computing. We received a number of grants from the National Institutes of Health for supporting that work, looking at things like prediction and prevention of suicide, recovery from depression, and other topics like that, but really focused on young people. But then about 2 years ago, I really felt, and this was, I might say, a complete surprise to me. I'm not a person who ever thought I would go into business, but it really became compelling to me that the best way to move this work forward was to start a company. And so we established our company, Ksana Health, in 2019, and that's been a wild ride, but it's really been a great one because it's offered the opportunity to take what we've been learning and generating through our research work and translate it into products that hopefully can have a real impact on the way we deliver services to people experiencing mental health difficulties.
That's incredible. Yeah, that's interesting, that concept that building a business might be the best way to figure out what works and bring it to market. What led you to that conclusion? There's obviously other ways, right? There's nonprofit, there's a university research, there's lots of ways to explore bringing solutions to people. How did you land on the conclusion that doing it as a for-profit business would make the most sense?
If we take a step back and look at the academic career, I feel in a way like I spent a long time doing everything exactly the way you're meant to do it. I identified the problem, I did research on it, I got funding for the research, we published it in good journals, we identified, targets for intervention, we developed interventions, we tested in the randomized controlled trials, we published that in good good journals. But the frustration was, once you've done all that, then how do you get it out there? And I found that as an academic, I was not really prepared with the tools to actually disseminate this work in a way that was going to really have impact. So we wanted to sort of, if you like, own the rails a little bit more. We wanted to have the control of the way that the work gets disseminated. And I think that, because our work was in digital and it involved software, there was a way to get funding and support through a for-profit mechanism to iterate quickly and to, work on product market fit, and then to hopefully, be able to scale with impact. That just there was a model there that was really compelling and available, I think, that you just don't have when you're based at a university.
I wanted to ask a kind of basic question to you, Nick, which is, what is Ksana and what are you focused on today?
So the aim of Ksana is essentially to take part in a digital transformation of the way we deliver mental health care. And what I mean by a digital transformation is that we systematically create and collect data on all the different processes in mental health care and make those data available and useful in near real time to sort of improve the quality of services and the accessibility and the effectiveness. So, for example, one of our core methodologies is what we call mobile sensing. Other people call it digital phenotyping. There's a lot of different terms for it. But essentially, it's using people's personal devices, particularly in our case, the smartphone, to collect data on behavior that is informative about people's mental health and the strategies that might be most supportive for them. So, we use the sensors on the phone to collect data on sleep, on physical activity, on geographic mobility, on language, which tells us a lot about mood and cognition, and a range of other things that all are able to give us continuous measurement of these patterns of behavior. And the continuous aspect is really important because, as I'm sure you know, one of the things that is really important in understanding someone's mental health journey is not just where they are right now at any given snapshot of time, but the patterns that emerge over time. One of my friends, who's a researcher I collaborate with, talks about, he said, sometimes we're trying to understand dancing by taking snapshots, and so, we're missing the whole point. You can't really see the dance. And so when you look at something like, let's take sleep, for example, sleep is something that has a rhythm in people's lives. And very often when people are experiencing a mental health difficulty or in the early stages of that, one of the canaries in the coal mine is, if you like, is this sleep becomes dysregulated. And yet often that's not well perceived by the person themselves. And it's not until the mental health situation has reached a much more severe state that you do this retrospective and you say, look, there was this early warning sign here. So, with our methods, we're hoping to be able to understand these early warning signs of shifts in people's mental health and well-being that are represented not only by this question of how much did you sleep last night, for example, but what kind of pattern of change do we see within your data across time? So that's really the kind of the core methodology that we have in our approach. And so we use that to make those data available to the clinician in their assessment and their monitoring of how their client or patient is doing across time. So that's one form of digitization, if you like. There's new kind of data that we haven't had before because we've relied so heavily on self-report in this area, and making it actually clinically useful so that the clinician isn't getting overwhelmed by this kind of fire hose of data, but rather picking out the features that are really important for them in their clinical decision making. And then, of course, the other part of what we're interested in is actually what does the clinician do with those data? And so we also want to quantify and collect data on the actual therapy plans that they're building with their clients. And by doing that, we're also able to make data available to the system about which therapy plans are working for which individual, in what way. But importantly, we can do that in near real time because the data is digitized and available to the clinician themselves, and also to the system that they're working in. So the system can learn very quickly about how to be more effective with the specific community that they work with.
That's pretty fascinating. Being able to know what's working and not working for different types of people is really interesting to me. I mean, it seems like in the physical health space, if somebody has heart disease or a broken leg, we have a really good sense of what will or won't work for them. Why do we not really have a data set like that yet in behavioral health?
Well, I think in many ways it's because we haven't had the methods up until now to collect those data continuously and automatically. So let me give you an example. Let's look at prescribing medication. Because prescribing medication is a regulated activity, you have data on who's been prescribed what, when, for which kinds of problems, and so forth. This is part of the routine data set that's collected. But that's not true in behavioral health care. You know, when we have someone who's using various techniques within, say, cognitive behavior therapy or one of the other approaches, dialectical behavior therapy, interpersonal therapy, etc., all evidence-based approaches, by which we mean they've all got evidence that this treatment package works for some people some of the time on average. But what is really hard to learn about in a systematic way is which particular elements of each of those treatment packages really are most effective for which people. And by digitizing that data on the therapy plan and matching that together with data on people's functioning and recovery over time, you can actually start asking these questions in a systematic way using data, and you can also learn in near real time. A lot of this data is collected at the moment in one way or another, but it's all in written files and other things like that that are not available for this kind of more real-time analysis and learning.
That's pretty interesting too. The fact that data it's out there, but it's in these fragmented locations. It's written down. It feels like to me that the mental health care market is very fragmented. There's a lot of antiquated techniques as far as how we treat patient data. Has that been a barrier here? And if so, how do you overcome that with providers who might not be used to using something more advanced than pen and paper for record keeping or measuring or tracking how their patients do?
Yeah, so I 100% agree with your question there. That has been a big barrier in mental health care, the lack of collecting routine data. But here's the critical thing: we need to find ways of collecting those data that fit in with the clinician's workflow. One of the things that we don't want to do is we don't want to create a lot of extra kind of regulatory activity on the behalf of clinicians. Here's why. Number one, it's not using their best skills. If we're getting them to do a lot of kind of clerical record keeping, because these are people who are often, fairly expensive to employ, and they're highly trained, and what they love to do is actually work with people and help them. That's what they're good at. And so they should be freed up as much as possible to really focus on that task, which is the task that uses their skills. So this is the dilemma. On one hand, we want to collect data better, but on the other hand, we don't want to place the burden of that data collection onto the clinicians, because we want them using those special skills that they have of working clinically. Secondly, we know that the more you burden clinicians with this kind of activity, the more they experience stress and burnout. So what we really need to do is we need to learn to automate aspects of this data collection so that it's generated kind of naturally in the clinical process. And that's exactly what our system that we're developing at Ksana does. It basically gives the clinician a set of digital tools that they use in their work with their clients and patients as they're building the therapy plans and pushing them out to the client to support their behavior change. But by doing that as part of the clinical process, we're also enabling the digitization of that data and then making it available to the practitioner themselves as well as the healthcare system so that they can do this kind of learning. So there's an important role for collecting the data, but it's also very important that we develop ways of doing that are automated and that don't create extra sort of administrative and regulatory burden for clinicians, because that would be, kind of going against the ultimate goal that we have.
I would be remiss if I didn't ask, and this might be a pretty novice question, but other than sleep data, what are some of the things that you would be willing to share that you do track and measure in order to provide this information back to, or these insights back to the clinician?
Yeah, so we collect, apart from sleep, the other data that we collect data on patterns of physical activity. So how much are people sedentary, how much people do incidental activity like walking, if they do any planned activity like running and cycling, for example, and how much time they spend driving. So, we have that kind of data. We also have data on social connection. I mean, when you look at what people use their phones for, it's largely for social connection in one way or another. And that is especially true of young people, where our work is focused. So they see the phone primarily as a tool of social connection. And so it can give you insights into important aspects of how frequently people connect socially, what kinds of things they're saying to each other. And we do that through looking at the language that they're putting into the phone. Now, I should say, just to address a question that I suspect is on your mind and maybe the listeners as well, is that obviously those kinds of data, those language data, are very privacy sensitive. So we have developed methods for looking at patterns of language, and we calculate those on the device so that, in fact, the specific details of what you're talking about or who you're talking with never leaves the device, but data or statistics on the patterns of language are the ones that leave the device and go up to the cloud and then are available to the clinicians. So you can look at patterns associated with things like positive versus negative language, self-focus, cognitive rigidity. These are all things that you can extract from people's natural patterns of language. And then finally, the other one we look at is patterns of movement throughout the world. So to take one simple example, there's some very good evidence in our work and also in other people's work that the amount of time that you spend at home versus out of home can be an indicator of mental health and well-being. Now, of course, most of this data was collected prior to the pandemic, and data during the pandemic will be completely different on this point. But nevertheless, it's a potential marker of wellness and functioning that we can use. So there's other points of data, but that gives you an idea. And so if we think about some of the key legs to the stool, if you like, of mental health and well-being are captured here. We know that sleep, exercise and physical activity, social connection, all critical aspects of how people are functioning and what their well-being is like. Probably the one that we don't address explicitly that also seems to have a pretty strong relationship is diet and nutrition. So that's something that we aren't collecting with our current methods, but we feel like we've got hold of a number of really critical dimensions, and importantly, these are dimensions of behaviour that clinicians really care about. They're often targets for behaviour change. So when you're working with a client, it's very common for you to set them behaviour change tasks that have to do with improving their sleep, improving their exercise and physical activity, or improving their patterns of social connection and social communication.
What you've done so far, Nick, is absolutely amazing, and what you're building is incredibly awesome. I'm curious what's next on your journey. It looks like from the press I've seen, you've raised some capital. You've raised it from hands down the best investors in this space. And I'm curious, as that evolved and now that that's done, what was that like? Where are you going next? What does the future post fundraising look like for you guys?
So really the next steps for us are to work on a series of pilot programs with our digital platform that we call Vera. And we've already got a couple of really great partnerships set up. We've got one, we've been accepted into the Anthem digital incubator. And so we'll be working with clinical practice sites as part of the Beacon Behavioural Healthcare Network that is part of Anthem's portfolio. And the second big project we have set up is with Northwestern University and Rush Hospital in Chicago, which is going to be focused on management of mental health in primary care. And we're seeking a series of others. We've got some, as people say, we've got some in the pipeline that are looking really really great and really promising, and they're yet to be locked in. But we're looking for a range of these so that we can go through, first of all, a rigorous process of user-centered design. We want to build software that people really want to use, both clinicians and patients and mental health service users. And so we want to do that user-centered design stage and make sure that it really fits in with workflows, that it feels useful and comfortable and really like a benefit to the people who are using it. And that's not true of all software, as we know. The second thing we want to do is we want to do an initial set of clinical trials on feasibility and acceptability, but also looking into the effectiveness of the approach. Does it actually have a return on investment that provides a better outcome compared to standard practice? So hopefully that's something that we'll be doing over the next 6 to 9 months. And then after, and essentially, like most people at this seed stage, we're trying to establish really strong product market fit. When we've established that, then we will obviously be looking to scale and really have impact with the tools, and hopefully be part of a whole range of companies that are really trying to push a digital transformation in mental health care.
Who would you like to connect with? I mean, are you looking for folks to use the platform? Are you looking for clinicians? If some of the folks in our audience are listening and they love what you're doing, which I do, if they want to get plugged in, how do people get involved with what you're doing?
So the groups that we really want to work with right now are provider networks, whether they be, in insurance, in universities, in large employers, in telehealth. We really want to work with a range of different kinds of use cases. And like I say, we're not going to come in and say, here's our software, you've got to kind of like it or lump it. It's more that we want to work in partnership with each of these different kinds of stakeholder groups and understand exactly what are the dynamics of their care system, what are the dynamics of their business, so that we can understand how to iterate on our product to really make sure that it fits well. Because I can't emphasize that issue enough. Most clinicians, when you come in with new software, they roll their eyes and they assume it's going to be a pain in the neck. It's going to be something that's going to, create extra burden. It's going to waste their time. It's going to be difficult to use. And so we're really determined to partner with all the stakeholders, whether they be the patients or clients of the service, whether it be the clinicians or whether it be the business gatekeepers, and make sure that we're building something that's really going to fit with them. So we're interested in working with anyone who is, you would say it's a B2B to C model. It's we want to sell to the systems that ultimately get the benefit of providing better, more efficient mental health care, because that will in fact reduce crises, make clinical activities more efficient, and therefore there's a clear ROI for those businesses at both a financial and a moral and, duty of care kind of level.
I think there's a huge need for this in the market. I think a lot of people have tried to do digital phenotyping. There are certainly a lot of people trying to do measurement and testing in the behavioral health space. I don't think anybody's figured it out. I think that a lot of the people that tried to do it early have pivoted away from it into providing care and sort of bailed out on the technology. I believe that the technology, the ability to gather the data has changed rapidly in the last 7, 5, maybe 3 years. And so I think the landscape has changed. So I think there's just such a huge opportunity in front of you coming into the market at the right time. Is that how you would think about it, or am I looking at it the wrong way?
Oh, no, I 100% agree. And of course, we're very well aware of some of the companies that came in early, looking at digital phenotyping, and that have pivoted away, as you say. And so we've looked at those cases and asked the question of how can we do this better? Why do we feel that we're in a position to perhaps crack this problem in a different way? I think there's a couple of things. I think one is the issue that you refer to, which is that I think the science and the technology is a bit more advanced now, so that we can actually start to measure some of these things with greater fidelity. But I think the other thing that's really important, and it's important in our approach, is that we've taken a different look at this. Let me explain why. The very early attempts to use digital phenotyping saw it as largely a diagnostic tool. So they basically said, okay, this is a great, exciting new kind of data. Let's use this to replace the PHQ-9 or the DSM-4 or whatever it is you wanted to replace. Like we can use this as a different way to say, is someone experiencing depression or anxiety or PTSD or whatever it might be? And, I understand the excitement about that because one of the things that we've really lacked in mental health is objective biomarkers of the different kinds of problems that people experience in this space. But the limitation of that approach is that once you've done that diagnosis, what then? Does it actually inform treatment planning? And that's where, we looked at what clinicians actually do. And actually clinicians, saying that someone, for example, is experiencing depression is only the first step for a clinician. A clinician then wants to ask, okay, what are the patterns of behavior that are influencing that person's depression, that maybe are keeping them stuck in that pattern? And then they start to ask questions not about these diagnostic concepts, but particular patterns of behavior like sleep, physical activity, social connection, cognition, etc., because they are the points of intervention, right? They are the targets of intervention. So for a clinician, simply being told this patient is experiencing depression is somewhat useful, but doesn't really get you where you want to go. You want to actually understand things like what are the specific behaviors that apply to this specific person and how are they changing over time? And when we modify those behaviors, does that result in symptomatic or functional improvement? So we said to ourselves, we're not going to emphasize this question of can we diagnose depression? We're going to say, can we measure sleep? Can we measure physical activity? Can we measure social connection? Can we measure cognition? And those turn out actually to be much more tractable problems. And also, they're much more clinically useful than simply a diagnosis. So I think that's one of the philosophical adjustments that we've made that we feel provides us with some confidence that this approach is really perhaps going to have more success.
I think that's incredible. I agree with you. I think the time that you're coming into the market and I think the approach that you're taking, it's incredible. And I think you have some incredible investors and an awesome board member. And I think you're set up really well to have a huge impact. One thing I like to ask founders after they raise money in our space is, what advice would you have for founders in the mental health space now that you've successfully raised capital and you're off to, building and growing and scaling? What did you learn from that process that you would pass down to some of our listeners who are very early stage? Maybe they are clinicians or they are professors or they are college students looking to build in this space and they want to go out and raise that seed round. What do you wish someone had told you that you learned along the way?
Well, I think we have a board of advisors that helped us right from the get-go. These are people who were in our networks and were really very supportive. And one of them is a good friend of mine named Kate Niederhofer. And I remember early on when we were beginning to talk to investors and we were getting a lot of, look, this is interesting, but it's too early. It's, it's not de-risked enough for us, maybe later and, all that kind of stuff. I remember she said to me once, listen, Nick, the right money is out there for you. You just need to find it. and I didn't necessarily fully believe her at the time, but it turns out she was right, So I think that as with many things in life, one of the big things that determines success is persistence. And you just need to play it out. And like I said, find the right money, find the people who actually believe in what you're doing, are willing to tolerate the risks that you represent, but also see the upside, and believe in the upside. And, we were lucky enough that eventually we found those people, including some of the investors you mentioned, who could see, that this, as with all startups, it's a risky proposition, but who could see the upside. So, we had to, as you say, we had to kiss a lot of frogs before we found our prince and princesses. But they were there. And so, I think the biggest thing is don't get discouraged. Keep talking to everybody you can talk to, not just investors, but people in the field. Have a learn it all, kind of mentality. take feedback, but don't overly react to just one piece of negative feedback. Look for patterns in the feedback and just persist. And I think that our experience has at least been that when you do that, you do find the right people. And I couldn't be more excited about the group that we have supporting us now, because they're all strategic. They've all got different slight angles on the sector and on the set of problems, but they're just a great group. And we feel really lucky that we've got a group who really is believing in the company and where it can go. But I can assure you that did not happen overnight. That took some time.
And I don't want to understate this. I think if I were a seed stage founder in this space, I would view your cap table as perfect. The people who are in it know the space better than anybody. They are incredible investors. They are all extremely strategic. So if you're a founder out there, you're listening to this and you're thinking, where should I go? Who should I call? I would read the press release on Ksana's seed round. The investors that invested in this round are hands down the best, most informed investors in the behavioral health space at the seed Series A stage that I've come across in the market. No questions. One last thing I wanted to ask you is about white space in the behavioral health startup opportunity world. You have your business, you have your focus, you're heading out to accomplish great things with it. I'm sure you look left and you look right and you see other opportunities that look appealing. And as any founder knows, you have to stay laser focused on your mission. What are some of the other opportunities you see out there for aspiring founders to tackle that would maybe be complementary to what you're doing, or maybe you just noticed it because you're in this space?
Yeah, I think that's a great question, by the way. I think that what this approach of collecting data on human behavior in a new way, as we can do with this mobile sensing or digital phenotyping approach, opens up all sorts of opportunities, both in health and in other areas like public policy and so forth. Because when you think about it, human behavior is really at the core of most of the complicated problems we're trying to solve right now, whether it's climate change or crime or racial injustice or income inequality or whatever it might be, that we could go on and on. Human behavior is really at the core of that. And one of the big challenges we've had is that the way we measure human behavior is really antiquated. It's based on asking people what they think about what they did, which is not, by the way, useless, but it doesn't tell you the whole story. It never tells you the whole story. And plus, because it's burdensome to do, you can't ask people that often. And so you lose this kind of temporal aspect of the data. So in terms of the white space question, think about all the areas where if we could understand better patterns of human behavior, we could have greater impact. So there are other areas that are in mental health and adjacent to mental health, substance use, and so forth. There's the interface between mental health and physical health, which I think is huge. We know, for example, if we could understand human behavior and patterns of human behavior after liver transplant surgery or heart surgery, and understanding what impact does that have on people's patterns of recovery and wellness after those incredibly expensive and stressful procedures, that could be a game changer. When you look at chronic disease like diabetes, for example, what is the role of behavior in actually helping people to live healthy, happy lives who are dealing with that condition? There are other issues like, when we introduce policies, public policies, do they have the impact on behavior that we really want them to have? Which policies are effective? A current example that's really important is vaccination rates. Now, one of the advantages of studying vaccination is that you've actually got a behavioral marker of whether someone's done it or not that's collected. But if you have other kinds of targets that maybe are not as well collected, then, having methods of collecting those. So I guess what I am excited about in general is this idea that if we can collect data on human behavior in a new way and do it ethically and do it with proper respect for privacy and security of those data, then it's going to create a data set that's going to help us to understand and hopefully solve some of the biggest challenges that we're facing as a community.
That'd be great. And I think there's a lot of folks that want to build and solve those problems and bring those solutions to market. So I appreciate you sharing those thoughts. And I've really enjoyed this conversation. My takeaway is that you're doing something absolutely amazing. What If Ventures messed up by not being in that seed round. I love the cap table you have and the mission that you're on and the technology that you've built. And I'm excited for what you're going to do for the mental health care space. I'm really, really grateful that you took the time to come and share the story with us. And, I look forward to seeing what you guys accomplish over the next few years. And, we'd love to be helpful in any way we can.
That's fantastic, Stephen. And thank you so much. We've, throughout our journey, we've really relied on your work, not just the podcast, but some of the analysis of the business space that you've done has been just been incredibly beneficial for us, in thinking through things. So really appreciate what you do. And it's been an absolute privilege to spend some time.
Thank you again, Nick, for being here today and for sharing with us. That was fascinating. It's really incredible the work you've done with your career. It's incredible what you're building with Ksana. Your work in the space broadly is fascinating to me, and your insights about building a business in this space, I think, will be helpful to many people who come behind you and try to build solutions to help people. So very grateful that you would take your time to do this. There are a number of ways to get in touch with Nick at Ksana Health. I will link to all of those in the show notes. To our listeners, thank you for being here. And if you like this conversation, if you like our content, please give us a subscribe or a like or a review on your podcast platform of choice. And more importantly, we'd love for you to share this with a friend. To the founders out there, don't forget to join the Mental Health Startup Slack community, which you can also find a link to in the show notes, and check out the What If Fellowship program, which is our 8-week accelerator designed to help mental health and digital health startups broadly validate their idea, perfect their business plan, and get ready to pitch investors to raise capital to bring their ideas to market. You can learn more about that through the fellowship tab on the What If Ventures website and a link in the show notes. Finally, we want to hear from you. We want to hear from our listeners. Please comment on social media. Let us know what you liked, what you didn't like, what you agreed with, disagreed with. You can reach out to us on Twitter at StigmaCast, on Instagram at Stigma Podcast. You can email us, info@stigmapodcast.com. And you can obviously find us on our website at stigmapodcast.com. Thank you again for being here. And until next time, stay safe, be well, and thank you for your support.